Welcome to the Knowledge Today channel. What is coronavirus? Coronavirus, COVID-19, is the illness caused by a new strain of coronavirus first identified in Wuhan City, China. It can cause a new continuous cough, fever, or loss of, or change in, sense of smell or taste, anosmia. Generally, coronavirus can cause more severe symptoms in people with weakened immune systems, older people, and those with long-term conditions like diabetes, cancer and chronic lung disease. This is a rapidly changing situation which is being monitored carefully. Higher risk of severe illness. Some people are at higher risk of developing severe illness with coronavirus. These people should strictly follow physical distancing measures. Their household and other contacts should also strictly follow physical distancing advice. Extremely high risk of severe illness. Some groups of people are considered to be at extremely high risk of severe illness with coronavirus. These people should strictly follow physical distancing and hygiene measures. Their household and other contacts should strictly follow physical distancing and hygiene measures to protect them. I'm not sure if I fall into one of the more vulnerable groups. What should I do? If you have an underlying health condition or take medicines regularly but you're not sure whether or not you fall into one of the more vulnerable groups, you should phone your GP practice and say you want advice about your underlying condition or your medicines. People who are considered to be extremely vulnerable to severe illness will receive a letter giving them further advice, but if you remain unsure, contact your GP. Symptoms of coronavirus. The most common symptoms are new, continuous cough, fever/high temperature, 37.8 C or greater, loss of, or change in, sense of smell or taste, anosmia. A new continuous cough is where you have a new cough that's lasted for an hour. Have had 3 or more episodes of coughing in 24 hours. Are coughing more than usual. A high temperature is feeling hot to the touch on your chest or back. You don't need to measure your temperature. You may feel warm, cold, or shivery. Some people will have more serious symptoms, including pneumonia or difficulty breathing, which might require admission to hospital. Could I have coronavirus? Use this guide to find out what to do next if you have developed any of these symptoms and are worried about coronavirus. If you have coronavirus symptoms, if you've developed symptoms, however mild, stay at home for 10 days from the start of your symptoms and arrange to be tested. Do not go to your GP, pharmacy, or hospital. You should remain at home until you get the result of the test, and then follow the advice you will be given based on the result. Read our stay-at-home guidance for households with possible coronavirus infection. When to get help. Only phone 111 if your symptoms worsen during home isolation, especially if you're in a high or extremely high risk group. Breathlessness develops or worsens, particularly if you're in a high or extremely high risk group. Your symptoms haven't improved in 10 days. If you have a medical emergency, phone 999 and tell them you have coronavirus symptoms. Fever following a vaccination. If a child or adult develops fever following a vaccination, this would normally be within the first 48 hours after the time of vaccination and should usually go away within 48 hours from the start of your symptoms. It is quite common to have a fever after a vaccination. You should only self-isolate or book a test during this time if you also either have other coronavirus symptoms, a new continuous cough or a loss of, or change in, sense of smell or taste. Have been told by NHS Test and Protect that you are a close contact of someone who has tested positive for coronavirus. Live with someone who has recently tested positive for coronavirus. Live with someone who has symptoms of coronavirus. If the fever starts beyond 48 hours from the time of vaccination, or persists beyond 48 hours, you should self-isolate and book a coronavirus test. Your household should follow the guidance for households with possible coronavirus infection. How soon after contact with the virus do people become unwell? Because this is a new virus, we do not know enough to have a precise incubation period. Experience so far suggests the average time it takes for symptoms to develop is 4 to 6 days after exposure, but it may be as short as 1 day or much longer. Do the people I live with need to take any action? If you live with other people and have symptoms, they'll need to stay at home for 14 days from the start of your symptoms even if they don't have symptoms themselves. If they develop symptoms within the 14 days, they need to stay at home for 10 days from the day their symptoms started and arrange to be tested. They should do this even if it takes them over the 14-day isolation period. Your whole household should follow our stay-at-home guidance for households with possible coronavirus infection. Get an isolation note to give to your employer. You can send an isolation note to your employer as proof you need to stay off work because of coronavirus. You don't need to get a note from a GP. Is there anything I can do to prepare? You should start planning now for how you would manage a period of self-isolation just in case everyone in your household needs to stay at home. Testing for coronavirus. Anyone with symptoms of coronavirus should be tested. You can book a test for yourself, someone you care for, a child in your care, key workers, and anyone in their household with symptoms can access testing through their employer in the first instance and will be given priority. If you test positive for the virus, your close contacts will be traced as part of the National Test and Protect approach to containing the virus. Overseas visitors, asylum seekers, and refugees. People who have come to Scotland to work, study or claim asylum, including refugees, will not pay for any coronavirus tests or treatments they need. How the virus spreads. Because it's a new illness, we don't know exactly how the virus spreads from person to person. People can become infected when droplets land directly on them or they touch contaminated objects and surfaces. That is why good respiratory hygiene and hand washing are so important. The virus might also spread by people 2 days before developing symptoms or by those who don't develop significant symptoms at all. How to avoid catching coronavirus? You can reduce your risk of getting and spreading the infection by avoiding direct hand contact with your eyes, nose, and mouth. Maintaining good hand hygiene. Avoiding direct contact with people that have a respiratory illness and avoiding using their personal items such as their mobile phone. Covering your nose and mouth when coughing or sneezing with disposable tissues and disposing of them in the nearest waste bin after use. Following the guidance for households with possible coronavirus infection and arranging to be tested if someone in your household has symptoms. Making sure everyone in your household follows the Scottish Government's coronavirus advice as much as possible and to stay away from other people. Making sure your household follows the physical distancing advice, especially anyone in a vulnerable group. Food. You can't catch coronavirus from food. But it is possible to catch it if you touch an infected surface or object and then touch your mouth or nose. Wash your hands regularly. Wash your hands with soap and water or alcohol hand sanitizer before eating and drinking, and after coughing, sneezing, and going to the toilet.